Did you know that back pain might be caused by zombie cells? Scientists have discovered that targeting these cells could be the key to relieving chronic low back pain. Let's explore this groundbreaking research. I'm Dr. Tammy Penhollow, Precision Regenerative Medicine, a joint and spine care specialist. And today we're looking at the research out of Montreal, Canada. It's super exciting. Yes, it is in the mice model, but I'm super excited for it to come to the human side. And we'll talk about what we do have currently for the human side. But for now, let's dive into this really cool research. So why does back pain linger even after you've rested, you've taken some meds like anti-inflammatories or some Tylenol, or in a severe situation, you had to be on muscle relaxants? What about if you've done weeks and weeks of physical therapy or have even had surgery? Why does the back pain still stay there? This introduces that certain cells within the discs themselves, the discs of the spine, may be the root cause. These are called zombie cells, which is just kind of a fun term for the senescent cells. It means that these cells are old, they're damaged, they stop dividing. Normal cells are healthy and they divide, but yet they don't die. They don't undergo that process called apoptosis, where then they can be broken down and taken out of the body. Instead, they sit there like grumpy old neighbors who rule in the block party, but they won't move out. They stick around and they release these harmful chemicals that are inflammatory signals, and those cells then prevent their neighbor cells from doing their job. It's like this vicious cycle, and it's a snowball. So zombie cells aren't all that great. The research breakthrough is that the scientists in Montreal, Canada, tested two drugs. The first one's called O-vanillin, and the second's called RG7112. These were in mice with a degenerative disc, similar to what causes human low back pain. So what happens in a degenerative disc situation, it's kind of like arthritis of the disc. The discs become dry. They can get tears, kind of like little fissures. If you do a chainsaw cut through a tree and you see the rings, the discs are like that. They have these little rings in them, and they can get a fissure through them or kind of a crack in it, like you were to take an axe to the wood and you start to see a split. And instead of it being a tree, it's a disc that has some fluid in it, disc fluid, and that can leak out, and that can be like this slow leak in a tire. So over time, the height of the discs reduces, and when that happens, imagine if I took this disc out here, or I made it even smaller. Well, what's happening is this little hole where the nerve rootlet comes out has gotten smaller. It used to be this big, and now it's this big. So as the nerve rootlet comes into contact with the bone on the sides, that can cause pain that comes down into the leg in a specific distribution. It also decreases the amount of space in the canal back behind here, and that can cause restriction in movement. And typically when we talk about disc-related pain, it might be that across the low back, just this low axial back pain that may drop down into the buttocks, kind of is a ache, can be a little bit tingly into the butt, and just is not good. You don't feel good sitting. Oftentimes getting up and walking around a little bit helps, or the people who want to relieve some of the pressure on the back posterior elements, as we call them, the back part. If they're at the shopping center, they're leaning on the cart, because what does that do? That kind of opens up this space here. And you see how that space changes then if you're leaning backwards, say doing a back bend or yoga. So it leans them forward, opens up the holes here, and gives a little bit more space. So that's what happens when we have degenerative disc disease. So that was a little lesson in anatomy, sorry. So these two drugs, vanillin, O-vanillin, and RG7112, the mice either got vanillin, they got RG, or they got both. The mice who got both of these compounds in an oral form had less pain, less inflammation, and healthier discs. They actually did sampling of the discs. They actually had the mice do grip strength testing, which is pretty cool because we've talked about grip strength testing as a measure of longevity. So the combo worked better than using just one drug. Let's say, why do these drugs work? What are these drugs anyway? I don't even know what they are. O-vanillin is a natural compound. It's actually found in turmeric. And Who hasn't heard of curcumin or the curcuminoids in terms of anti-inflammatories? Well, in this case, the O-vanillin weakened the zombie cells. So then they didn't have the ability to be that angry guy at the block party who's poisoning the party. RG7112 is a more powerful drug that does have some known studies in osteoarthritis and cancer, but had never previously been used in back pain. So that helps clear the zombie cells out. So we weaken them with one drug, we clear them out with another drug, meaning that we've got healthier cells that are remaining. So together they clean the spine's house, and this means that we're going to have healthier disc cells. The disc volume increased. So remember that slow leak of the tire? It's like we patched the tire, and not only that, but we filled it with some air. Way cool. That gives a lot more space for these nerve rootlets as they run around down into the legs, and you're less likely to have the pain in the mice. It also improved the osteopenia, or the decreased bone density in the adjacent vertebrae. So say this disc was the degenerative one. These bones are not happy because they're next to a degenerative disc. They actually got stronger, because osteopenia can also contribute to low back pain. Disc volume, we change the osteopenia, and they change what's called neuroplasticity. We have activated microglia. I consider the microglia like the foot soldiers of the brain and spinal cord, and they get a memory where if there's pain, it has a memory and it keeps saying that there's pain, and that synapses on the spinal cord feedback loop to pain. Feedback loop to the spinal cord, feedback loop to pain. But if you strengthen the microglia cells, then you kind of control-alt-delete the spinal cord and all the pain signals. So very, very interesting. And again, this was in the mice model. Why does this apply to humans? Because chronic back pain affects millions of people, and it's so hard to treat. In fact, it's the number one reason that we have disability in the US. I know we talk about knee pain a lot on this channel, but everybody with knees also has a spine. And sometimes we've talked about how knee pain can actually be coming from the spine, and spine pain can radiate to the knee. So it is important for anybody who has a spine to know that treating chronic low back pain is a game changer in terms of your ability to function, the ability to do everything you want to do. So the current options are painkillers or surgery, where you get hardware in the spine, they take out a disc, they shave off a disc, they rotor-rooter the holes in here, they increase the height by putting screws and plates and try to maintain that. But then we get stiffness, we get the adjacent segments that then get wear and tear because we fixed these segments. And it's just this permanent vicious cycle. Other things we do have the ability to do right now is the orthobiologics, or using PRP or bone marrow. And I'm going to talk about that in a second. But again, bringing it back to how can we apply this mice model thing into a human? Well, it opens the door for future treatments that we can target these zombie cells, get them out of the discs, and help people. In the future, we can look at other natural flavonoids. So that's what curcumin is. That's what the O-vanillin is. That's what these are. So it's something that might be dietary, might be that we can take orally instead of having to use maybe IV infusions or injecting into the discs. Right now we have some disc injection therapies. On that note, there are some wider applications of targeting the zombie cells, because they're not just in discs, but in diabetic kidney disease, in osteopenia, in physical dysfunction, in a whole realm of both health span and lifespan. So the final takeaways here, as we move into what we can do right now, we can, in orthopedic biologics or musculoskeletal orthobiologics, however you want to call it, what we do in regenerative medicine at Precision is we can target these discs specifically, and we can use your body's own cells. Nothing else is legal at this point. Everything else is in a research pipeline. So remember, you cannot use birth tissues legally in the United States at this time. You cannot use the expanded mesenchymal stem cells in the United States at this time. So no Wharton's jelly, no amniotic cells, no cord blood cells, no exosomes are legal in the US. And particularly, I'm talking about your spine, but it's widespread. What we can use is your body's own blood, and use PRP in a very highly concentrated dose into the discs. We can use your body's own bone marrow, concentrate that down and put it into the discs. And that is similar. It has so many of those anti-inflammatory cytokines. Its hope is to stop the leakage of the tire. Its hope is to stop the degeneration and make the bones healthier at the adjacent segments because you don't have the chronic inflammation in the disc because you've treated the disc. One of my favorite books in the world, and something that I do recommend, Heal Your Disc, End Your Back Pain. It is by the late, great Gregory Lutz, absolutely amazing colleague. And it's why I'm so passionate about treating the disc. So we can do something right now, PRP or bone marrow aspirate concentrate. We're looking at something like this coming through the Montreal group and the mice model. But at this point, what I'd like you to do is drop any questions in the comments below, to like and subscribe so you can get more information like this. And we'd love to hear from you. Again, Dr. Tammy Penhollow, let's treat your discs.
If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.